Good day, colleagues. My name is Pavel Gavrilov. I'm the moderator at Tomopractica channel. Let's get started. And today I'd like to talk with you about something practical, how to measure pleural fluid volume on CT. It's a simple topic, but as you'll see, there are some useful tricks that can really help in daily practice. Now, let's be clear right from the beginning. In most cases, you don't actually need a precise measurement. For example, pleural fluid isn't even listed as a measurable parameter in oncology under the RECIST criteria, which we use to assess how patients respond to chemotherapy. And that's quite logical. Pleural fluid is a very dynamic parameter. Think about it. The pleura can produce up to 100 milliliters of fluid per hour and absorb up to 300 milliliters per hour. So, as you can imagine, the numbers can change pretty quickly. The first method is very straightforward if you have the right equipment. With a dedicated workstation and the right software, you can get automatic volume measurements that are both quick and accurate. In practice, it's often just a matter of a few clicks. But of course, not everyone has such a workstation at hand. So here's another option that works almost anywhere, the Hazlinger stripe thickness method. The idea is really simple. You take an axial CT slice, measure the maximum depth of the effusion perpendicular to the parietal pleura, and then put that number into a formula. Or even better, just check a lookup table. Now, you do see the formula on this slide, but honestly, in daily practice, it's usually faster to rely on the table. For instance, if the maximum depth is about 2 centimeters, that corresponds to roughly 200 milliliters of fluid. So instead of doing the math, you can just glance at the table and get a quick estimate. Of course, like any method, this one has its limitations. First of all, it only works for freely distributed effusions, not for loculated ones. We'll cover those separately in another session. Secondly, it's most reliable for volumes up to about 1 to 1.5 liters. At very low or very high volumes, the accuracy isn't great. But let me stress again, in most clinical situations, you don't really need milliliter level precision. An approximate volume is usually enough to make the right decision. So, to sum it up, this method is a very handy way to get a quick, reasonably accurate assessment of free pleural fluid on CT. It's not perfect, but in many cases, it gives you exactly the information you need without extra effort. Thank you all for your attention. I hope this short overview will make your everyday practice a little easier. Thank you.